Take deep breath in, inhale. All the way out, exhale. Okay, one more time, inhale, exhale. Good, okay. One more time, inhale, exhale. Good. Okay, lower back, inhale, hold it. Okay, good. Okay, turn sideways. Your body go against the, yes, sorry. Okay, so this hand, good. Yeah, look back tight, yeah, the other side. Elbow. Good, a little bit, yes. Okay, on your back. Yeah, scoot up, side up a little bit. Okay, good, stay here, okay? Okay, yeah, make sure that, yes. Oh, nice, good. Get some movement. Yes, good. Good, okay. Good. Oh, good, perfect. And then I'm gonna do some traction in neck and shoulder, right? So slide down a little bit. No, like slide down little bit more. Little bit more. Good. Okay. Perfect. Yes. Stay here. Okay. Yeah. Lift up your head a little bit. Okay. Good. Okay. Your head. Okay. Yeah. Relax. Mm-hmm. Okay, turn the body sideways, right? Sideways using elbow hand push.
Sideways here.
Yes. And then using elbow and hand push yourself up, yes, it's easier. So when you get up, even in the morning. So when I do the traction, anything move, neck, upper back, a little bit. When I do the traction, like which part you move? Shoulder, neck. I forgot. Don't worry. So when I try to decompress your spine, right? So as we age, as we get older, the disc always decrease, right? When the disc compress, pinch your nerve. So what I do when I try to decompress your spine, get more space, okay? So okay, sit all the way back. Okay, good. Okay, your hand do it this under the head. I try to carry you on my back, okay, on my back. Under the hair is easier. Under the hair, yes. So okay, is it possible? Oh, good. Okay, give me some space. And then relax upper back, okay? Let's see if I can do this. Okay, lean back, relax. Good. A little bit. Yes, good. Yeah, shoulder, I know. Yeah. So, but you feel it, right? Upper back, mid back, you feel move.
Yeah.
Okay, good. So, little bit better. Tell me.
Yeah.
Oh.
Yeah, it's open.
Open, yeah, open.